Assalamualaikum warahmatullahi wabarakatuh. Hello, I am Musnika Muharani Albantani from the Biology Education, Faculty of Teacher Training and Education of UHAMKA. On this occasion, I will deliver material of kidney anatomy. Even though the learning system is turning online, I hope this doesn't reduce the enthusiasm of friends to gain knowledge and continue learning or working in this time of limitation. And I hope always be healthy and happy. Now, let's get to know of the kidney anatomy and their function in the body. The renal or kidney is one of the most important organs in the body, which is located on the right and left side under the back ribs. This organ is located inside the back is the size of an adult's fist and look like a red bean. Kidney are two organs that function to filter blood and waste substances in the body that come from food, drug, and toxic substances. The renal anatomy generally consists of 4 parts. 1. The nephron, 2. The renal cortex, 3. The renal medulla, and 4. The renal pelvis. 1. The nephron. In each kidney, there are about 1 million nephrons. One of the most important parts of kidney anatomy is responsible for filtering blood, absorbing nutrients, and removing metabolic waste product through urine. Each nephron consists of a structure, namely 1. Renal corpus or Mafigi body. The renal corpus consists of 2 parts, namely the glomerulus or capillary collection that absorb protein from the blood and the Bowman capsule. 2. Renal tubule. This collection of tubes that run from the Bowman capsule to the collecting tubule consists of the proximal tubule, the loop of Henle, and the distal tubule. Blood flows through the nephron to the renal corpus. Furthermore, the protein in the blood will be absorbed by the glomerulus. Meanwhile, the remaining fluid will be drained into the collecting duct or collecting duct. Then, some of it will be reabsorbed into the blood, including water, sugar, and electrolyte. 2. The renal cortex. The renal cortex is the outermost part of the kidney anatomy. This section is lined with fatty tissue known as the renal capsule or kidney capsule. The cortex serves to protect the inner structure of the kidney. 3. The renal medulla. In the renal anatomy arrangement, the renal medulla is a tissue of a soft consistency. In it there are 1. Renal pyramids. These are small structures containing nephrons and tubule. This tubule which transport fluid to the kidney. Then the fluid moves toward the inner structure that collect and transport urine out of the kidney. 2. The collectivus duct. Each end of the nephron contains a collectivus duct that filters fluid out of the nephron. After the collecting duct, fluid will be moved to the renal pelvis. 4. The renal pelvis. The renal pelvis is the deepest part of the kidney anatomy. The shape of this organ resembles a funnel and acts as a storage area for urine, as well as a channel for water passage from the kidney to the bladder. And now, let's talk about the process of forming urine in the human urinary system, where one of the organs involved is the kidney. Urine is the result of metabolic waste through the secretion process from the kidney, which is then excreted from the body through the urinary tract. Urine usually contains substances that are no longer needed by the body, so it needs to be excreted because they can poison the body. The formation of urine usually consists of 3 stages, namely filtration, reabsorption, and augmentation or secretion. Filtration. This urine formation process is carried out with the help of the kidney. Each kidney has about 1 million nephrons where urine is formed. At any given time, about 20% of the blood will pass through the kidney to be filtered. This is done so that the body can remove metabolic waste substances and maintain fluid balance, blood pH, and blood levels. The blood filtering process begins in the kidney. Blood that contains metabolic waste substances will be filtered because it can be toxic to the body. This stage occurs in the Mafigi body, which consists of glomerulus and Bowman capsule. The glomerulus is in charge of filtering water, salt, glucose, amino acid, urea, and other waste to pass through the Bowman capsule. The result of this filtering is then referred to as primary urine. Primary urine, including urea in it, is the result of ammonia that has accumulated. This occurs when the liver processes amino acid and is filtering by the glomerulus. Reabsorption. After filtration, the next urine formation process is reabsorption. That is, refiltering. About 43 gallons of liquid go through the filtration process. However, most of it will be reabsorbed before being expelled from the body. The absorption of the fluid is carried out in the proximal tubule of the nephron, distal tubule, and the collecting tubule. Water, glucose, amino acids, sodium, and other nutrients are reabsorbed into the bloodstream in the capillaries surrounding the tubule. After that, water moves through the osmosis process, which is the movement of water from an area of high concentration to a lower concentration. The result of this process is secondary urine. In general, all of the glucose is reabsorbed. However, this doesn't apply to diabetics because excess glucose will remain in the filtrate. Sodium and other ions are reabsorbed incompletely and remain in the filtrate in large quantities. This condition can occur when a person consumes more food, resulting in a higher blood concentration. Hormones regulate the active transport process. Ions such as sodium and phosphorus are reabsorbed. Augmentation or secretion. Secretion is the last stage of the urine formation process. Some substances flow directly from the blood around the distal tubule and collecting tubule to this tubule. This stage is also part of the body's mechanism to maintain the acid-base pH balance in the body. Potassium ions, calcium ion, and ammonia also go through a secretion process. Like some drugs, this is done so that the chemical compound in the blood also remain balanced. This process is carried out by increasing the secretion of substances such as potassium and calcium when the concentration is high. In addition, reabsorption is also increased and reduced secretion when the concentration is low. The urine made by this process then flows into the middle part of the kidney called the pelvis, where it flows into the ureter and then deposits in the bladder. Furthermore, urine flows into the urethra and will come out when you urinate. This process produces urine which consists of several substances, namely water, urea, a waste that is formed when protein is broken down, urochrome, the pigment blood that makes the urine yellow, salt, creatinine, ammonia, and other compounds that bile produced from the liver. Therefore, normal urine is usually clear yellow. How far do the kidney function for the human body? The pair of kidney are located on the left and right along the back muscle wall or posterior muscle of the abdominal cavity. Due to the asymmetrical shape of the abdominal cavity, the kidney are not located at an exact height. These two fish-sized pea-shaped organs are 10 cm up to 12 cm long and 6 cm wide. In every day, the kidney function to filter 150 liters of blood. Meanwhile, 2 liters of which are waste substances from food, drugs, and toxic substances extracted through urine. Therefore, this organ is equipped with a ureter or bladder which is responsible for carrying urine out of the body. In addition to filtering blood and removing waste from the body, the kidney also functions to reabsorb substances that the body needs such as amino acid, sugar, sodium, potassium, and other nutritional content. The kidney also functions to regulate the balances of electrolyte and body fluid. If kidney health is not maintained, there are various threatening risks. Not maintaining optimal kidney health can cause various kidney diseases that are harmful to the body, such as chronic kidney failure, kidney stones, acute nephritis, and urinary tract infection. Unfortunately, individuals with kidney problems often do not realize the symptoms it causes until kidney disease enters an advanced stage. Some of the symptoms that individuals with kidney problem may experience include anxious, it's hard to concentrate, insomnia, decreased appetite, dry and itchy skin, muscle cramp, change in frequency of urination, pain when urinating, foamy pee, bloody urine, swelling around the eyes and feet. In addition, increasing age can also cause the body organs to decline in function, including the kidney. Ways to maintain kidney health is stay active and fit. Regular exercise is not only done to lose weight, but also can reduce the risk of chronic kidney disease. Exercise can reduce blood pressure and improve heart health, both of which are important for preventing kidney damage. Control your blood sugar. People with diabetes or high blood sugar can experience kidney damage. When your body cells can't use the glucose or sugar in your blood, your kidney are forced to work extra hard to filter your blood. Monitor your blood pressure. High blood pressure can cause kidney damage. If high blood pressure is accompanied by other health problems such as diabetes, heart disease, or high cholesterol, it can have a more dangerous impact on your body. Drink lots of fluids. Drink 8 glasses in one day is the most appropriate method to encourage you to stay hydrated. Regular and consistent water intake has a good impact on the health of your kidney. Deep bad habits such as smoking, drinking alcohol, and eating fast food. With smoking damages the blood vessels of your body. This results in slower blood flow throughout the body, especially to your kidney. Smoking also puts your kidney at increased risk of cancer. Well, that was the discussion about your kidney anatomy. I hope what I convey can be understood well. Sorry if there are mistakes in the delivery of words. And thank you for your attention given to the presentation of the material. See you the next opportunity. Finally kalam. Wassalamualaikum warahmatullahi wabarakatuh.